Dr. P here. I want to talk to you about the descent of the vagus nerve. Now here's the vagus and glossopharyngeal nerve. As we work our way down, you can see the nerves crossing anterolateral, and you're going to follow them into a space right between the internal carotid artery and the jugular vein. Now I'm going to go down as far as I can, and this is where you're going to find the vagus nerve on your way down, traveling between these two structures. So sometimes you're going to have to infer its location, and this is especially important when you're looking at glomus vagale tumors or schwannomas of the vagus nerve. Now I'm going to go as low as I can. I've got the internal carotid artery. I can't see the external branches all that well, and I'm not down to the level of the common carotid artery yet, but that's relevant. So keep these two structures in mind. For the right and left vagus nerves descend from the cranial vault through the jugular foramen, and they penetrate the carotid sheath between the internal and external carotid arteries, and then they pass posterolateral. We're not at the level of the common carotid artery, but if this were the common carotid artery, the perforation is kind of in a posterolateral orientation to the common carotid artery into the carotid sheath. Now, for those of you that are medical students or studying for anatomic exams, the cell bodies of the visceral afferent fibers of the vagus nerve are located bilaterally in the inferior ganglion of the vagus nerve, which is known as, board question, the nodose ganglion. Now, the right vagus nerve gives rise to the right recurrent laryngeal nerve, which I'm not going to show now because we're in the brain, and it hooks around the right subclavian artery and ascends into the neck between the trachea and the esophagus in the right tracheo-esophageal groove. The right vagus then crosses anterior to the right subclavian artery. It runs behind the superior vena cava and descends posterior to the right main stem bronchus, and then contributes to cardiac, pulmonary, and esophageal plexuses. It forms the posterior vagal trunk as the lower part of the esophagus, and then it enters the diaphragm through the esophageal hiatus. Now you can stop right now if you want, but for you med students and residents out there, the left vagus nerve then enters the thorax on the opposite side between the left common carotid artery and the left subclavian artery, and it descends on the aortic arch. It gives rise to the left recurrent laryngeal nerve, which hooks around the aortic arch to the left of the ligamentum arteriosum and ascends between the trachea and esophagus in the left TE groove. The left vagus further gives off thoracic cardiac branches. It breaks into a pulmonary plexus. It continues into the esophageal plexus. And finally, it enters the abdomen as the anterior vagal trunk in the esophageal hiatus of the diaphragm. Probably more than you wanted to know, but Dr. P out.